Welcome back. Thousands of healthcare workers, including paramedics across New South Wales, will walk off the job again this morning, fighting for better pay.
Dolly Borg is a ward assistant at a Sydney hospital and is joining the action today. She joins us now. Dolly, really nice to see you this morning. Why are you joining the protest today?
For better pay conditions and to get a pay rise and to get more staffing levels.
Dolly, I don't think anyone would dispute that nurses deserve more pay after the 2 years you've had. Paint us a picture of what a typical day at work looks like for you.
At the moment, we're very, very short-staffed, and of course we've been through the whole pandemic. Nobody's complained about anything. We come to work, we come here for the patients. That's what it's all about.
And Dolly,
And
look...
at the end of the day... Sorry?
Yeah, continue.
Sorry, like at the end of the day, we come to work, we're very low income workers and we worked right through the whole pandemic, didn't argue, didn't say a word, and for what we get paid, it's not worth it. And we haven't had a pay rise or an increase in I don't know how long. And the government they just keep taking, and with the price of everything going up, how are we going to afford to feed the kids? How are we going to buy petrol to come to work? It's all right for the government to say sorry. Sorry's not enough.
Pretty emotional, Dolly, isn't it?
It is.
Why are you upset right now?
Because I don't think that we're actually appreciated. Like, nobody asks how we are. Nobody says, are you okay? It's all about them. It's okay for them. They can go out and do whatever they like, the politicians. They've got money. Let them come in and see what we have to do on a day-to-day basis, what we've got to put up with. And we don't complain. Yet they're too lousy to give a pay rise to us. What's going to happen in the future? Are we going to be on the poverty line? We're not in a third world country. This is Australia. We're here. We're supposed to be family. The
Dolly,
politicians don't see that. It's all about them and how they can save money.
Dolly, the Premier says a 2.5% wage increase for health workers is enough. What do you say to him?
No, it's not. Have a look what we've got to live on. We don't earn $60,000. We're lucky if we earn $50,000 a year. We are the lowest income workers in the public health system. And sorry and thank you isn't enough. We need action. We need to know that we can put food on the table, buy petrol to come to work at a reasonable price. Not say, oh, sorry, I can't come to work today because I don't have money to buy petrol. I don't have money to buy a bus ticket. 2.5 is not enough.
Dolly, we can hear, it comes through very strongly, your frustration, your anger and desperation with this situation, and there are going to be thousands of people protesting today. Know that you are being heard and we really appreciate your time this morning. Good luck.
Know that you're being appreciated as well, the work you've done over the last 2 years and beyond.
Thank you, Dolly.
Thank you very much. Thank you.
But it does make a great point of what our politicians don't hear. I mean, I know with Dolly, like she would turn up to some of her shifts 3 hours beforehand because other staff members were so stressed and understaffed that they go above and beyond, a lot of the time not being paid their overtime. And as she just pointed out and made very clear, not feeling appreciated.
And when the cost of living is going up, they go backwards. They shouldn't be going backwards after the 2 years they've had when the entire country depended on nurses.